And right now, joining me up on the dock is Melanie Sweeny from PDC. And in this podcast, we're going to delve into the world of patient care workflows, such as patient identification, medication administration, and specimen collection. We'll explore the vital role identification plays in safe and efficient patient care. And our expert guest from PDC will share insights on the direct impact that high-quality ID solutions can have on improving workflow efficiencies and preventing medical errors. We'll explore how focusing on the right solutions can save your staff time and frustrations, allowing them the freedom to focus on patient care, which is the most important thing. Melanie, thank you for joining us today up here on our dock. Isn't this a nice dock?
It is a nice dock. Thank you.
Yeah. I mean, we don't have any life vests or anything like that.
Dock of the Bay.
Dock of the Bay, right? So if you fall off the dock, I hope you can swim.
I can't.
You can't swim. Just first of all, let's start by asking just about PDC. Tell me what you guys do.
Yeah. So at PDC, think of it as we identify pretty much anything within a hospital.
Okay.
So it could be a person, it could be a thing, it could be a place. So it really ties into the media and all the different things that you would use within a hospital.
Okay. So when you say identify, what exactly, obviously we're talking like name badges, things like that, everything across the board.
Yeah. Your employee identification, how they might be identifying visitors as they come in, access control as you're moving throughout the hospital.
Okay.
The patients themselves. You might even need signage, right? Where you've got signs all over the hospital indicating where to go. Kind of anything, we can do a lot.
The world of identification in the healthcare setting, specimen, name badges, I mean, everything from is so important, right? Because so much depends on knowing sure that the right labels are on the right things. Is that correct?
Yeah, absolutely. I mean, when you think about the wristbands and labels, right?
Yeah.
Specifically, which is what we're most commonly known for.
Okay.
I mean, I was even born with a PDC wristband, so I make a lot of jokes about that for this. When you think about media in that context, it plays a really big role in patient care, right? If you misidentify a patient, it can be very costly for hospitals and health systems. I think that as a country, we probably spend over billions of dollars on that each year. I personally think it's something we don't talk about enough. So if you think about identifying specimens or identifying patients in that way and the tools that are used for that, it's very important.
Yeah. And how does it help with the workflow in the hospital too?
Well, as far as the workflow goes, I mean, it can help or it can deter it, right? So if you're not using the right products, if you're not using medical grade labels, if you're not using the right wristbands, all of those things can contribute to patient errors, right? If you're using a wristband that might fall off or it's not suited for the environment that patient is going into, again, it can fall off. It could lead to misidentifying them. Now you maybe have a patient roaming around the hospital. So it plays a big role in patient safety.
And just from a workflow too, from the actual frontline, the people that are the nurses and everybody else that are dealing with things, even the food service people that come in have to check the name badge before they give them the food to make sure it's the right people. So from a workflow standpoint, good identification really helps the whole hospital kind of work in a more streamlined way. Is that correct?
Absolutely. Yes. You want to identify who's in your hospital, whether it's visitors or staff or your patient, right? And you want to know where they should be.
What advice would you give healthcare systems that are looking to streamline their workflows and improve patient care? What advice from your standpoint?
I would say there's really two things. So I think first and foremost, really pay attention to the clinical staff and what are they doing? Are they creating workarounds, right? Like as far as clinical staff goes, we all know that they're incredibly resourceful. Right. So they might find alternative ways to work around this wristband that keeps falling off or a scanner that's not scanning the wristband. Maybe the patient's had that on for 7+ days and really should be rebanded. First, look at those workflows and see what they're doing and work towards improving that, right? And then second, really, we can't emphasize enough barcode, making sure that you're doing thermal printing and barcoding everything that touches that patient. Doing those things can really increase efficiency. They can make the workflow much better for the staff. You know, one example is if you're not using direct thermal printing, right? And they're printing at, say, maybe an inkjet or a laser printer that's a nursing station in the middle of the room, right, versus by the patient's bedside. Now that clinician is having to walk back to a central area and print, and it might be a shared printer. And in that case, what if two nurses are printing the same
You grab the wrong one.
and you grab the wrong one, right? So it's really about looking at what your staff is doing, what are the pain points in their workflow, and then work with someone like PDC or another supplier and really us and look through.
Because you're the best.
Yeah. Work through how do we improve that, right?
Yeah.
If you think about, when a patient comes into your hospital or your medical office, right? If that wristband, the patient ID wristband, for example, if it's hard for your staff to put it on to them, or
Right.
maybe it's really stiff and it doesn't feel comfortable, that really can affect how they perceive their care and what is it going to be like the rest of the stay, right? I think a lot of people, especially in this space, you're probably hyper aware as you go to healthcare facilities and paying attention to those minute details where maybe others may not.
Yeah. Let's talk about some of the best practices that you've seen from your standpoint. Like, what would you tell some of the hospitals out there as far as best practices for their workflow when it comes to identification?
Well, first and foremost, I'd say there's probably 2 points, and I'm going to talk about the hardware, and then I would talk more about the media, the
Okay.
wristbands and labels again. So as far as the media goes, again, for the reasons I talked about thermal earlier, right? Thermal printing is not only more efficient, but it does drive a lot more cost savings. It reduces a lot of waste. You have
Okay.
the ability to kind of print on demand. And again, it speeds up that time that a clinician can spend with the patient's care as opposed to, fiddling around with their media or their wristbands or labels. Also look at your scanning, right? There's a lot of barcode scanning implemented in healthcare today. Are your scanners scanning that barcode every time, or are they struggling? And is it time for a refresh, right? If you think about the media piece of it, making sure that you're using quality products that are designed for the healthcare space. I mean, we see very often that health facilities will use, a standard paper label, and they find that it's falling off in the
Sure.
right? And then there you go. You're
Right.
leading to potentially you've lost that patient specimen, and maybe now you need to go back and collect it again. So making sure that you're using products that are really designed for the medical space and trying to use technology to your advantage, using thermal printing, bedside scanning, all of those things to kind of really make sure that that patient is being taken care of and there's no risks involved.
The day to day with using your products, what do you see from from your clients' response to you guys, like your feedback and testimonials about your products and how you guys have helped with the workflow overall?
Yeah. So recently we did help a large healthcare system. They were looking at implementing their door-to-doc time, right? So as patients,
I'm sorry, say that again.
their door-to-doc time.
Door to doc. Okay.
Yes. So as patients are being admitted into their ED, for example, they wanted to reduce that amount of time that it took for the patient to get to the bed and be seen by a doctor.
Got it.
So they reached out to us about how do we do this, right? And we collaborated with, let's implement mobile workstations. So that would allow for each nurse to check in the patient right there at the bedside as they come in, and it sped up their door-to-doc time by, I think, 47%.
Oh, wow. That's a huge improvement.
Huge improvement, especially when you think about patient satisfaction, right? We don't want to sit in an ER forever. I just did that with my mother not long ago. It was 12 hours. You don't want to do that.
Right.
You want to be able to get in your room, see the doctor, start your treatment, and
Right.
hopefully you're leaving as quickly as possible.
But what would you tell somebody in a sales pitch as far as an elevator to say, hey, this is why you should go with us?
I would say really PDC loves solving problems, right?
Oh,
We
cool.
love for people to come with us with, I have this problem or this workflow is not efficient or maybe this product's not working. We love to find creative ways to meet people how they are today or where they're going to be in the future, right? In that example of the health system I spoke about, they weren't ready to implement this kind of process a few years ago. And here we are 3-4 years later, and they're ready to do that. So we love having people come to us and say, this is a challenge that I have, or this is a workflow that isn't working and I want to improve it. Those are the things that I think we're really good at. We have a lot of field sales representation. We have R&D that's there to help us. And we've even created unique products for health systems to solve their challenges.
Melanie, thank you so much for joining us up here on the dock.
Yeah, thank you for having me.
It's been a pleasure. There's been no mosquitoes out today at the dock or nothing, so we're all good.
Did we wear a bug spray?
But thank you so much for joining us on the podcast, and thank you for sharing what PDC does.
Absolutely. Thank you.
Appreciate it. Thank you.
Thank you.